One of the most important strategies to get well and remain well for individuals with bipolar disorder is learning as much as you can about the illness, as well as engaging yourself as a proactive partner with the clinician or clinicians who may be treating you. First of all, we do know education is imperative. There are organizations out there who have a lot of information that people can learn about the illness or family members can learn about it. There are support groups that are out there, such as the DBSA, NAMI. All these are out there for individuals to feel like they're not alone. However, it's also important that the individual who has bipolar disorder stay engaged, and if there are issues that may contribute either to highs or lows, or may even be an issue around catching up on developmental issues that because it took so long for them to get diagnosed, they may benefit from therapy to help them kind of catch up for that lost time when they may have been depressed for a number of years or not diagnosed appropriately, or maybe even lost a business or had a broken relationship because of making poor decisions. So tailoring that treatment to the individual, including the psychosocial treatments and education, is imperative. In the ideal world, when we treat bipolar disorder, it would be nice if we had medicines with no side effects that we could predictably say treats both the highs and the lows. Unfortunately, we don't have those treatments for everyone yet. There are some people who take medicines who don't have side effects, whose moods are just fine. But on the other hand, there are side effects for many people that may be intolerable. Some of those may be sedation or it may be weight gain. There may be issues around taking medications and wanting to get pregnant. And in this case, I really suggest to individuals who are having issues with this to work with your clinician and discuss ways to either change medications, find strategies to manage what those side effects are, because it's really a risk and benefit. The ideal should be as minimal of side effects, but still trying to have the best efficacy over time. And very often it may take months, if not even a couple of years, to find the right treatments for the individual where their mood is stable and yet they're able to deal with side effects. Other side effects that may not be necessarily quote unquote life and death things, but they could be sexual side effects. Many of the antidepressants may blunt the individual's libido or may prevent orgasm. Again, I suggest discussing that with the clinician because there are ways to intervene. Some people with bipolar disorder will say they feel blunted. They don't feel as creative with their treatments. And it's important to make a good differential diagnosis. Is that the medicine or is it a symptom of some underlying depression yet that still needs to be addressed? Having the comorbid attention deficit disorder, because those two coexist together, sometimes having to manage those symptoms and or side effects together can prove very useful as long as the individual with the disorder plays a very proactive role with the people who are working with them. As a clinician, I can't stress enough how important it is that the individual who has bipolar disorder or a mood disorder in general has a good relationship with their providers, whether it's for therapy, their physicians, psychiatrists, whoever that may be, that they play a proactive role and that they have a good relationship, because it is that communication with that person that needs to be conveyed to the clinician that will eventually lead to the desired outcomes that the individual deserves to have. And sometimes it may take a while to establish that relationship. But also, if the individual feels like it can't be established, don't be afraid to get a second opinion, because it may take a couple tries till you find what that good fit is for the person who may be working with you for some time and you feel comfortable with. in today's climate of medicine, there's more and more pressure on physicians to see more patients in less time. And that can lead to obviously, not getting the full story and the full picture. For bipolar disorder, this is where life charting can be really helpful because the individual can come in with a whole month of data right there, and it can tell a lot. However, it is important to still make sure that that communication exists between the person with the illness and their physician. Make sure you get your points across. If you don't feel that your answers are, your questions are answered, make sure that you are persistent in getting to that point. And if working with a therapist, if that may be different than the psychiatrist, make sure that those two talk. Because again, in today's climate, it may not be that common where a therapist may talk to the person who's doing the meds. And as a clinician, I think it is very important that there is a team, and at the core and center of that team is the individual who's being treated. And unfortunately, that person may need to step up to the plate and make sure that communication exists, including even with a primary care physician or an OB person. If someone wants to get pregnant, there needs to always be that communication between the individuals who are working to make sure that patient's quality of life is being optimally met.